We're joined this morning by New York Congressman Anthony Weiner and Michigan Congressman Mike Rogers, who also happens to be a cancer survivor. Good morning to both of you.
Good morning.
Good morning, Gretchen.
All right, Congressman Weiner, I know that you have been in strong support of the government-run plan, the public option plan. Do you think it will come back on the table now? Is it true that President Obama is pushing now with at least the senators to put it back into the plan?
Well, it's going to be in the House plan, and I think it's going to wind up being in the law that gets passed because it's the way we save money. Without competition and choice, CBO says you're not going to keep the cost down of this thing because if we just leave it to the insurance companies, they're going to keep doing what they've been doing, which is raising our policies about $1,000 each year without even a sliver of competition. That's really all the public option is. We're not going to be able to hold down costs at all. So the president and most people who are fiscally conservative want to have that in there to control costs. They
want to have the public option?
You bet. You bet. CBO says that if you put the public option in there, we save an additional $150 billion.
Congressman Rogers?
Yeah. CBO said that the House bill actually costs us over $1 trillion in new debt. It doesn't save money. There isn't competition. We ought to, I can go to Michigan, I can go to Indiana and buy a car, my life insurance, I can buy my auto insurance. I can't buy my health insurance, even though the same plan by Blue Cross Blue Shield is about $300 cheaper. That's competition. We ought to remove those barriers. Having a government plan that sets all the rules, tells you what you can and can't offer, tells you what kind of treatment you can and can't get, is not competition, and at the end of the day, it doesn't save money, and Medicare is a great example of that. 3 times higher, more administrative costs in Medicare than any other private plan. Why would we subject the rest of America to something that's not working all that well efficient-wise?
Congressman Weiner, what I'm interested in from your point of view is the fact that the president appears to be pushing the public option again. There has been no direct signal from the White House, unless I've missed it, that he really is 100% behind the government-run option.
Well, frankly, the president in his speech before Congress came out and in strong support of the public option. And frankly, Mike has it exactly backwards. The administrative and overhead costs for private plans is about 30% compared to Medicare, which is 3.5%. And it's funny to hear yet another Republican critic criticizing Medicare. Medicare is efficient. 96% of all seniors say that they like it. That's a government plan. That's a plan that's efficient. And that's a plan that Americans say that they like. And yet for 44 years, my Republican friends have been trying to undermine it, and we're trying to strengthen it.
But apparently,
the funny thing is, Gretchen, the funny thing is they just cut Medicare in their own bill by $500 billion.
And apparently they're going to get rid of all the fraud to pay for health care reform. So which one is it?
Well, I mean, first of all, it isn't. They don't take fraud into consideration in costs. And by the way, Medicare is the most expensive end of the health care treatment. So if you would spread that over every single patient, they are 3 times more inefficient than any private plan. But they don't. They're picking and choosing. And Medicare, by the way, is a plan that you pay in for some 45 years and never take a dime out. What they're saying is we're going to pour whole bunches, millions of Americans into a plan that doesn't pay the cost of a doctor today, by the way, and it's somehow magically the math is going to work at the end of the day. If it's too good to be true, it probably is. In this case, they're going to break a system that is taking care of seniors that need some help anyway. And if we can't stop 10% of fraud, 10%, no business could survive at 10% fraud.
Interesting point.
Currently, that's where we're at in Medicare.
Congressman Weiner, 20 seconds.
Well, I'm having trouble keeping up. Was that Medicare picks and chooses? No, it covers everyone over 65. It's private insurance that created the term pre-existing condition. Look, if my colleague doesn't like Medicare, he's with a lot of his colleagues in the Republican Party. The question is, if it's good for people who are 65 and over, why not 64? Why not 63? That's the question. The public option is just that, an option for some people.
Interestingly enough, it's the 65 and older crowd who appear to be against health care reform.
100%. They love Medicare.
And they should be, Gretchen.
Congressman Rogers, it's so great to have both of you with me this morning. Thank you very much.
Thanks, Gretchen.